In cancer and neurodegenerative prevention therapies, what are the suggested posologies by the available research papers?
The suggested posologies, dosages, of methylene blue, MB, for cancer and neurodegenerative diseases vary significantly depending on the context, route of administration, and specific condition being targeted. Below is a summary of the dosages suggested by available research papers for both cancer and neurodegenerative disease prevention therapies. 1. Neurodegenerative diseases, e.g., Alzheimer's, Parkinson's. Methylene blue has been extensively studied for its neuroprotective effects in neurodegenerative diseases. The dosages used in preclinical and clinical studies are as follows. Preclinical studies, animal models. Dosage range, 0.5 to 4 mg/kg day, intraperitoneal or oral administration. Mechanism, at these doses, MB reduces tau aggregation, improves mitochondrial function, and enhances cognitive performance in animal models of Alzheimer's and Parkinson's diseases. Clinical studies, human trials. Low-dose MB, leucomethylthioneinium bis hydromethanesylfonate, LMTM. Dosage, 4 to 16 mg day, oral administration. Rationale, low doses of MB or its reduced form, LMTM, are used to avoid oxidative stress while still providing neuroprotective benefits. Outcome, in Phase 2/3 trials for Alzheimer's disease, LMTM showed potential in slowing cognitive decline and reducing tau pathology. High-dose MB. Dosage, 50 to 100 mg day, oral administration. Rationale, higher doses are used to target amyloid aggregation and enhance mitochondrial function. Outcome, some studies report cognitive improvement, but high doses may cause side effects like hemolysis or serotonin syndrome. Key considerations. Blood-brain barrier penetration, MB readily crosses the BBB, making oral administration effective. Dose-dependent effects, low doses are generally preferred for long-term use to avoid toxicity. 2. Cancer therapies. Methylene blue has shown potential in cancer therapy due to its ability to generate reactive oxygen species, ROS, inhibit mitochondrial function in cancer cells, and act as a photosensitizer in photodynamic therapy, PDT. The dosages used in research are as follows. Preclinical studies, in vitro and animal models. In vitro studies. Dosage, 1 to 10 m, micromolar, concentrations. Mechanism, MB induces ROS production, leading to cancer cell apoptosis. Animal studies. Dosage, 1 to 5 mg/kg, intravenous or intraperitoneal administration. Mechanism, MB selectively targets cancer cells by disrupting their mitochondrial function. Clinical studies, human trials. Photodynamic therapy, PDT. Dosage, 1 to 2 mg/kg, intravenous administration, followed by laser irradiation. Rationale, MB acts as a photosensitizer, generating cytotoxic ROS when exposed to specific wavelengths of light. Outcome, PDT with MB has shown efficacy in treating superficial cancers, e.g., bladder cancer, skin cancer. Monotherapy or adjuvant therapy. Dosage, 50 to 100 mg day, oral or intravenous administration. Rationale, MB's redox properties and mitochondrial targeting make it a potential adjuvant in chemotherapy. Outcome, limited clinical data, but preclinical studies suggest synergistic effects with conventional chemotherapies. Key considerations. Selective toxicity, MB's ability to generate ROS selectively in cancer cells, due to their altered metabolism, makes it a promising candidate. Combination therapies, MB is often used in combination with other treatments, e.g., chemotherapy, radiotherapy, to enhance efficacy. General guidelines for dosage. Low doses, neuroprotection. Range, 4 to 16 mg day, oral. Purpose, prevent protein aggregation, reduce oxidative stress, and enhance mitochondrial function. High doses, cancer therapy. Range, 50 to 100 mg day, oral or intravenous. Purpose, induce ROS production, disrupt mitochondrial function, and act as a photosensitizer in PDT. Safety and toxicity considerations. Low doses, generally well tolerated, with minimal side effects, e.g., mild gastrointestinal discomfort, blue discoloration of urine. High doses may cause hemolysis, serotonin syndrome, if combined with SSRIs, or methemoglobinemia. Contraindications: MB should be avoided in patients with G6PD deficiency due to the risk of hemolysis. Conclusion: the suggested posologies for methylene blue in neurodegenerative diseases and cancer depend on the intended therapeutic outcome. Neurodegenerative diseases, low doses, 4 to 16 mg day, are preferred for long-term neuroprotection. Cancer therapies, higher doses, 50 to 100 mg day, or photodynamic therapy protocols are used to induce selective cytotoxicity in cancer cells. Further clinical trials are needed to establish standardized dosing protocols and confirm the long-term safety and efficacy of MB in these contexts.